In this video, we're going to look at some myofascial exercises to help with pain and other symptoms that you may be feeling in your arms and your hands. So lots of people suffer from problems here, and depending on where they mainly feel the problem, they may get a diagnosis of a specific condition. So pain felt mainly in the forearm and elbow could be diagnosed as golfer's elbow or tennis elbow. If it's felt more in the wrist, it could be carpal tunnel syndrome or tendinitis. And if it's felt more in your fingers or causes problems with movement, it could be diagnosed as trigger finger. All of these conditions are also contained within the umbrella term RSI, or repetitive strain injury. And it's exactly what it says. Repetitive strain injury is caused by doing too much of one thing. In particular, anything that involves fine movement of your fingers and thumbs. So computer work is a very classic example of something that can start to cause problems like pain and other issues to develop in your hands and forearms. A lot of RSI problems actually come from further upstream in your neck or your chest or your armpit. But lots of people do specifically find that they have problems with their forearms, which can feel tight and sore. And this area is really important because you have lots of little muscles on this side of your forearm and on this side, which between them work your fingers and your thumb. And so because they're small muscles, they can get irritated and tired very easily. And as they get irritated, the fascia around them starts to change and thicken and sticks together. So instead of having lots of mobile little muscles in here, you have what feels like a solid lump. So these exercises can help to undo some of this restriction and give you more movement and freedom in your fingers and thumbs and reduce the pain and other symptoms that you may be feeling. So the first exercise we're going to do can be done on the floor, and this is to help stretch your forearms. So to stretch the underside of your forearms, place your hands flat on the floor close to your knees, and then come up onto your knees and just start to lean forwards. You will feel a stretch in the back of your forearms, which will come round from your hand, round your wrist and up into your arm. Only stretch as far as is comfortable, never stretch into pain, and don't put all your body weight on your hands. You're just using your hands on the floor to create a little bit of a lever for the stretch. So be in this stretch for at least a couple of minutes to feel things start to release, and then come out. To work on this side of your forearms, then turn your hands over so that the backs of your hands are flat on the floor. And then just gently start to lean back. Again, you'll start to feel a stretch that comes over the back of your hand, your wrist, and up into your forearm. And only stretch as far as is comfortable, waiting for a couple of minutes for things to release. Some people find that that version of the stretch is too much for them because they already have quite a lot of pain, especially around their wrist. If that's the case for you, then you can also do this stretch just by having your arm out in front of you and then just pushing the back of your hand back towards your forearm to create a stretch into this side of your wrist and into your forearm. And to work on the other side, turn your hand over and then just gently pull your fingers back towards you. And you'll find a stretch starting to come into your wrist and your forearm. Again, be here for at least a couple of minutes to allow time for things to start to stretch and let go. So some people find doing the stretch with their arm held out in front of them is quite tiring. So if your arms are already quite tight and sore, then holding them up can be quite tiring for you. In which case you can use a table or a chair arm to support your arm, making sure that your hand just drops over the edge And you can then create a stretch without having to hold your arm up as well. And then you can turn your hand over and do the same thing on the other side. This is actually quite a good one to do on a chair arm while you're watching TV or just relaxing at home. So you can also work on your forearms using a myofascial ball. So you can either use a larger inflatable one like this or a smaller trigger point ball like this. So if we start with the trigger point ball, so place it on a hard surface like a tabletop or a kitchen work surface, and then just very slowly roll your forearm over the ball, stopping on any areas that may feel a bit tight or sore and waiting for those to release. So you can work anywhere from your elbow to your wrist, and you can even come over your wrist onto your hand, just allowing time for the tissues to release and let go. So to work on the other side of your forearm, just turn your arm over, and again place the ball on a hard surface and just roll your forearm very gently and slowly over the ball, waiting on any areas that feel tight or sore so that they have time to release. And again, you can work anywhere from your elbow to your wrist. So by doing these exercises regularly, you can help to gradually loosen some of the tension in your forearms in particular that will be contributing to pain that you might be feeling in your hands and your arms. So you can find these and many other self-help myofascial release exercises in our Living Pain-Free online program, which you can find at our website along with our myofascial release kits.